Hi, my name is Maria Talosa Garcia. I'm one of the health educators here at Kaiser Permanente that teach the childbirth preparation class. In this demonstration, I will be showing you how to use a birth ball, which can be used to ease movement as well as provide you comfort when labor begins. One of the very first things to remember about a birth ball is that if you have a yoga ball or a exercise ball, they're all the same. But it's going to be very important to use a birth ball that is appropriate for your height. So if you are 5'2" and under, a birth ball that is, or a yoga ball or an exercise ball that is 55 centimeters is appropriate. If you are 5'3" and to 5'7", birth ball the size of 65 centimeters is appropriate for your height. And if you are 5'8" and taller, a birth ball that is 75 centimeters is definitely appropriate for your height. As you can see, I am already sitting on the birth ball, and what is going to be very important as you sit on the birth ball is that it is stable. If you have someone helping to support the birth ball, you can have them place the birth ball and stabilize it for you. And as you sit down, you want to make sure that your knees as well as your hip placement are on a 90-degree angle, and that your knees are on the same level as your lower hip. And as you're sitting down, you can add a little bit of bouncing movement, or you can also do a little bit of circles on the ball to help alleviate pressure that you are feeling on your pelvic floor. Another position that you can try, or movement that you can try while you're sitting on the ball, is to do a side lunge. And what this does is to actually help open up your pelvic outlet and provide you with perhaps that much needed stretch at this point on your during labor. 5 seconds on one side, and then the other side another 5 seconds. Just make sure that you do not overextend. Another position that you can try with the birth ball is the knee lean over the ball. And what this does is to provide you with some comfort in terms of back pain. And what you can do is make sure that your knees are wide open, and as you lean into the ball, find a spot where you feel comfortable on your chest, and you can either hug the ball this way or just have your hands hang down on the side. But you just need to find a spot that feels comfortable for you. You can stay this way, or you can add a little bit of side swaying movement to help that discomfort that you might be feeling on your back. What's going to be important on the knee lean position is that you are supporting your knees with either a mat or pillows to support the knees. And again, it might look like this, swaying side to side, or just breathing through that contraction, leaning against the ball. Another position that you can try using the ball is to hug the ball while the ball is against the wall. You want to make sure that you place the ball against the wall that is solid, so not against a door, so a solid wall, and just place it where you feel comfortable against your chest, and you can hug the ball this way. And if you would like to add movement, do some side swaying while hugging the ball against the wall. What this will do is help facilitate ease of movement again, and help baby descend a little bit lower. And you're also creating a bigger space on your pelvic outlet for baby to come down. Another position that you can use while you have the ball against the wall is to have your ball against the wall and your back onto it. And you might want to also make sure that it's placed where it feels comfortable for you. And in this position, you want to have a little bit of a semi-squat and do some side-to-side swaying as well. What you're doing is that you're using gravity to help baby come down a little bit lower, and you're also opening up your pelvic outlet for making more room for baby to descend. So we encourage you to bring your own birth ball, yoga ball, or exercise ball to the hospital when you are coming in. When you are inside labor and delivery room, you may certainly use the ball to continue providing you with the comfort during labor. One position that you can try when you are inside your labor and delivery room is to place the ball on top of the bed. And similar to the swaying motion while the ball is against the wall, instead this is on top of the bed. You would just kind of lean against it this way and make sure that your knees are wide apart and sway side to side. And this will provide you again with comfort for your back, as well as creating more room, opening up your pelvic outlet and helping baby descend a little bit lower. As you can see, there are many uses for the birth ball during labor. You can sit on it, you can also use it standing up, hugging it against the wall to provide you with that comfort and ease of movement during labor to cope through the discomfort of labor pain. Thank you very much, and I do encourage you to practice these in the upcoming weeks or even upcoming days.